Hello, my name is Hanif Numan. I am the Chief Sociologist of ReSCI Consulting, LLC, and I'd like to talk to you about our evidence-based approach. In doing so, I will use the analogy of a medical doctor to explain the four spheres of knowledge. The first one being knowledge of symptoms. For a medical doctor, the knowledge of symptom represents the cataloging of patient symptoms and developing systematic methods for detecting and measuring those symptoms. The idea being, of course, that with the accurate detection and recording of symptoms comes the ability to identify patterns of symptoms associated with specific diseases and syndromes. Those in the medical profession ask a predefined set of relevant questions of the patient and taking measurements such as temperature, pulse rate, and blood pressure. For an organization, the knowledge of symptoms involves the detection, description, and assessment of the current state of the organization and its members. In the case of the organization, the assembly of symptoms often begins with organizational members noting organizational anomalies or dysfunctions such as high levels of employee turnover, low scores on organizational climate surveys, declines in the quantity or quality of performance, or ineffective communication. ReSCI investigates the ostensible symptoms as well as seek out less obvious or even hidden symptoms. We assess the qualitative and quantitative symptoms with appropriate methods, integrate and summarize the assessed levels of the symptoms, and form a preliminary diagnosis. Then, we feed back the information to the members of the organization, cautioning them that the preliminary diagnosis might require additional study to confirm and map out the next steps in the process.